Hi, everyone. Welcome back to the Faster Way podcast. I am thrilled to be here today with Dr. Elisa Song, who is a pediatrician with 25 years of clinical experience. Elisa, thank you so much for being with us.
Oh, I'm so honored, and I'm really excited to speak with the moms in your group.
So we have bonded over a few things. First and foremost, we're both from the Northeast, and I love me a gal from the Northeast. I was born in Long Island. I was actually born in New York City, but lived in Long Island for some time. You lived in New Jersey. And the other thing that we're going to bond over is you understand that winter is a choice. So you went from New Jersey to now, I believe, California.
I love that. Yes, so true. It is a choice. We get to choose when we have freezing weather.
Exactly. Yes. I went from the Northeast and then actually the Midwest to Florida and Costa Rica. I just love the warm weather. And
Yes.
for me, it's actually interesting tie into our conversation because part of the reason that we decided to purchase a home in Costa Rica is because my kiddos were struggling quite a bit with different bugs, specifically last year, 2023, this year, 2024. 2024, the winter was absolutely horrendous. And so we're going to talk about that. We're going to dive in. But first, I want to hear when and why you entered into the wellness industry.
Yeah. Well, the when is really, from the time I was little, I always knew I wanted to work with kids. I mean, I loved babysitting. I loved being a camp counselor. I mean, all the things. And so, working with children was a no-brainer. But the wellness world wasn't really. My mom was a busy OBGYN, and I'm like, I do not want that life. I mean, it was tough. I mean, she was never home on the weekends. I mean, delivering her own babies. And so it wasn't really the thing that I thought medicine was supposed to be for and a career for me. But then, when I was at Stanford, and this was a long time ago. This was in the late 80s. I stumbled upon this flyer for this American Holistic Medical Association. And I'm like, what is that? Never heard the term. And so I went to this conference, and it was folks just getting known like Andrew Weil and Deepak Chopra and Joan Borisenko. And my mind was blown. I'm like, wow. Okay. If medicine could be kind of like this, then maybe I do want to do that. Maybe I do want to, be a pediatrician. And so that's informed from the time I went to medical school all the way through residency. I always knew I wanted to do something more in the health and wellness space, the more holistic space. And the further I got along in my journey, it was so clear this is really the only way to practice and the only way we're really going to help our kids thrive.
Yeah, absolutely. So you've had 25 years now in this particular space. You've seen a lot. You've worked with many, many different patients. And recently you decided to write a book. So tell me a little bit about the book. What is it called? What is the content? And then we're going to dive in.
Yeah. So the book is called Healthy Kids, Happy Kids, an integrative pediatrician's guide to whole child resilience. And when you look at the burst, it says why your child's microbiome holds the key to lifelong wellness. And, many listeners have heard of the microbiome, maybe even taking a probiotic supplement here and there or giving one to their kids. But when we understand that your child's microbiome lays the foundation for their developing immune system, for their developing brain and mental health future on, even for their future epigenetic potential, it just makes it so clear. When we take that microbiome first approach, we can create all sorts of thriving resilience for the rest of their lives. So that's why I wrote the book, to share the science, but then as a busy mom myself, the how, let's get it done. How do we do it? But not just how do we do it? How do we get our kids on board? And it's all about making it fun and practical and doable.
Okay. I love a few of the keywords that you've already shared. Microbiome. We talk quite a bit about the gut health or microbiome in the Faster Way.
Yes.
Our gut is like the second brain. And if we don't mind our gut health, then we're going to have issues long term. The other word that I love is resilience. Resilient. Oh, I mean, the thought of empowering my children to be resilient is so energizing in so many aspects. Health, emotionally, physically, spiritually. I think that's absolutely key. Tell me just a little bit about your family, your kiddos.
So my kids we are in the tween and teen stage. Gotta
Oh,
love that stage. I mean,
yes.
they're still super cute and innocent. They're still kind of naive to the world, which I will take. I'll for sure take that. So they're 12 and they're 14, 12 and a half and 14. My younger son Bodhi he's just he's a mama's boy.
Oh,
He loves his mama. And, my daughter is fiercely independent. So I love that about both of them. And, this is real life. I understand they're out in the world now making a lot of their own choices. They're buying food and buying drinks with their friends. And so this is all about how do we instill the knowledge in them so that they make informed choices. That's what it's all about. It's not about like, oh my gosh, never ever get that that mocha frappuccino thing that has the 50 grams of sugar. It's like, okay, well, if you're going to make that decision, let's think about what that really means for your body and your brain. And I love that they cook. I mean, the pandemic was an odd time for all of us. I mean, thank goodness we're kind of heading out of that, but our immune systems still are not quite back to where they were pre-pandemic.
right.
That is why resilience is so key, as you noted. I mean, it's been tough, and we're just rebuilding our immune resilience. But
Yeah.
but they learned to cook, and now they are in the kitchen with me all the time. And that is really, as we're talking about, what's the fastest way to health? I mean, that is one of the fastest ways to get your kids moving towards the direction that we want.
Ugh, okay. I love this. So I, as you know, have 5 kids.
Mm-hmm.
Emma is 12, almost 13. Cole is 10, almost 11. Lily is 6. JJ is 3, and Ty is 1.
Yeah.
But I can really relate with your oldest two, or with your 2 kids, because my oldest, Emma is very independent, but just in the past 6 weeks, even, she and I have become close friends.
Yeah.
And recently I posted on Instagram a little reel, and I said, point of view when your firstborn becomes your bestie and your favorite workout partner.
Yeah.
She just recently started getting really interested in working out with me. And it's so fun. It's so cute. She adds a whole other entertainment value to my workout too, which makes the time pass.
Oh, yeah.
And then my son is also a mama's boy, and he is very responsible. He also cooks. I'll walk into the kitchen in the morning and he's making healthy pancakes and eggs for his little sisters. And he's the one, he gets everyone's lunchbox ready before school and the water bottle. And he sees a trainer a few times a week and is really getting excited about strength. My kindergartner, she's also excited about eating the right foods to be strong.
Yeah.
But let's just dive in. We're going to kind of hit some hot topics. We're going to talk more through the book as well. So you mentioned the pandemic. For us, the pandemic was an interesting time in Florida, specifically because our kids actually never skipped a beat. We were always around other kids. We were out of school in the spring of 2020, but my kids immediately started going to camp, and they were with other friends even in March, April, May of 2020, but they were outside a lot. So they're outside, they were, together. But even that being the case, where we actually kind of weren't, quarantined to the home in Florida, the past 2-3 years have been extremely challenging for my family on the germ front. And I've had a theory that viruses are now superbugs because they learned how to get around masks. They learned how to get around vaccines. They learned how to get around all the hand washing and the vigilance around that. And so we have been hit harder in my house than ever before, to the extent that I purchased a home in Costa Rica so that this coming winter we can separate ourselves from the germs a little bit, which it sounds so extreme. But Elisa, my 1-year-old and my 12-year-old contracted a 100-day cough this winter. Wow. Started in January. It impacted my daughter's entire middle school track season. Thankfully, she was then asked to run with the varsity team as a 6th grader and ended up overcoming cough 100 days later. It literally lasted 100 days. And then she was able to perform really well sub 6 minute mile. I mean, she's just
Wow.
an
Oh my gosh. Yeah.
insane runner. I mean, literally with cross country was on the varsity team as a sixth grader, went to state. But again, her entire middle school season had, this cough. It was almost like an asthma attack.
Yeah.
My 1-year-old I've never heard a cough like this in my life. I took him to a salt room every
Yeah.
single day. Salt room. I took him to a chiropractor twice a day for multiple weeks in a row. I can't live like that anymore. I mean, I was getting sick
Yeah.
left and right as well, but what do you attribute this to? Or am I wrong? I mean, is this kind of like a phenomena where the viruses are stronger, or is it just me because I'm basically running a daycare, so I'm just noticing it more?
Yes. I think it's a combination of both. What's really interesting is, of course, here in the San Francisco Bay Area, we were in lockdown for a very long time. And so I would have a lot of families comment, oh my gosh, this has been actually one of the best 2 winters, because for the first time, we're not getting sick. And I had worries about that back then because, we're supposed to get a little thing here and there and then get over it. And that's how, just like working out your muscles, your immune system needs a workout every once in a while. And even for the places where, you weren't as locked down as we were here in the Bay Area, people weren't traveling as much. There just wasn't a lot of kind of influx of germs from even other places. And so a lot of people had the experience that in those early days, there weren't all of a sudden, oh, wow, these common colds and these little flu bugs and tummy bugs, we're not having them anymore. And they didn't go away. But it's just that I think, a lot of these bugs now have the opportunity in this untrained immune system to go in, and they may be a little stronger, and our immune systems are definitely not used to it. And so the past 2 winters, really rough for a lot of kids, just like you're experiencing.
Yeah.
And the other thing that's really interesting too, I just read an article that during the pandemic, the inappropriate use of antibiotics for viral infections went way up. And that's something that, as we're talking about the microbiome and gut health, we need to, especially as parents, be really, really aware of, because sometimes antibiotics are absolutely needed. But in some studies, 70% of antibiotics prescribed for children are inappropriately prescribed.
Ugh.
And so what I love to do as a holistic integrated pediatrician is tell parents, hey, look, there may be a time for antibiotics, but here are all the things we can do in the meantime using herbs, homeopathy, acupressure points, essential oils, all the things that I've used in my practice successfully to say, can we get your kids better faster, knowing that most of the time it's a virus? So hopefully it doesn't lead to that 100-day cough. Hopefully it doesn't lead to, a bacterial super infection on top. And then most importantly, if you do need antibiotics, how do we recover your gut microbiome? Right.
Yeah.
But as, parents are listening, the mom is out there. If you're like, yeah, that was our winter, and it was really rough. 70 to 80% of your child's immune system is in their gut. And if we work on their gut microbiome, you might think, well, what about, giving, this supplement or that? Absolutely. There's a role for that. And we can talk about that. But, when we know that there are certain probiotic strains, for instance, that can significantly reduce the rates of fevers, colds and flus during the winter, missed days of school. And this is in children that have been studied from preschool all the way on up. So we start with the gut and the immune system will fall into place. This is also, a lot of parents, I would imagine a lot of the mamas listening, you've had some brushes with autoimmunity, or maybe you actually have an autoimmune concern. We know, autoimmunity in women is way higher than in men. We also know that the age group with the fastest rise in autoimmunity rates are our 12 to 19-year-olds. And yeah, right. And so when your child's microbiome holds that key for immune health, no matter what is going on from an immune perspective, whether it's autoimmunity or frequent colds, or maybe they have eczema or asthma, we look at the gut and we learn how to create microbiome resilience. You will create resilience in your kids.
Okay, let's dive more into the microbiome then, because I've been there. Many of the moms listening have been there. We have given our kids antibiotics. I have to tell you, Dr. Elisa. So my 3-year-old and my 1-year-old were getting constant ear infections. We're talking every 2 weeks, or they would seemingly get over it, and then rear its ugly head and turn into a full-blown double ear infection. So I, out of desperation, ended up taking them to an ear, nose, and throat specialist who, of course, recommended tubes, because when
Yeah.
you go to a surgeon, they're never going to say put a Band-Aid on it. They want to use a
Right.
scalpel. When you go to an ear, nose, throat specialist, they're going to say do some tubes. So no sooner did I do the tubes in the ears that we then had this cough scenario. And when
Yeah.
I took Ty to a chiropractor, she said, "Did you recently get tubes in his ears?" And I said, "Yes, as a matter of fact, I did." She said, "Well, often what happens is the infection then drains from the ears down into the chest. So now you were having kind of the consistent ear infections. Now we're going to have more of the cough issues, the
Yeah.
lung issues."
Yeah.
I'm like, "Oh my God, that totally makes sense.
Yeah.
Why was I not informed? Why did I not think about it?" And you feel like just a complete failure as a mom when this type of thing happens. But we have put our kids on antibiotics,
Yeah.
and with the 100-day cough this winter, which impacted people all over the country. I know this because I continue to post and ask for advice, and people are coming out of the woodwork, thousands of my Instagram followers, and saying, "Oh my God, we're dealing with it in Indiana. We're dealing with it in Pennsylvania.
Yeah.
We're dealing with it in California." I tried a few different rounds of antibiotics. Nothing helped. But where do I go from here?
Yeah.
Finally, the cough is gone. In the past couple of weeks, the cough is gone. Ty has the ear tubes, as does JJ. What do I do now to start repairing the gut health and really improving his immune system for next winter?
Yeah. Well, and the first thing I want to say is, we've all been there kind of grappling as moms. Even for me as a pediatrician, I don't want to be a mom to my kids. And when you're faced with, okay, do we do the antibiotics or not? There's often a lot of wiggle room. And I let every mom know both of my children had antibiotics when they were under 6 weeks of age. And,
Mm,
Kenzie had a UTI at
wow.
2 weeks of age, and I'm not going to mess with that. And Bodhi, there was strep going around our household, and he had this green gunk coming from his ear. We
Wow.
cultured it out, and it was strep. So, of course, I'm not going to, he was 4 or 5 weeks of age then. The key is, even if those antibiotics were years in the past, or maybe it's going on right now, we can reset and restore your child's microbiome. So it's never too late. It's easier, it's faster to do it if you start right away, but it's okay. If you're listening, you're like, oh my gosh, okay, like you, my kids had round after round after round when they were little. And now we're recognizing that this is not to scare mamas, it's just to inform. We know that antibiotics when you're younger in a child can increase or even double the risk of certain, almost every allergic condition by the time your kids are older, like
Wow.
eczema, asthma, allergies, hay fever, anaphylactic food allergies even. And same thing with mental health, with this epidemic of mental health concerns in our youth, our children, our teens, especially our teen girls. We know that antibiotics when you're younger can affect the gut-brain connection and how it's
Mm,
developing and increase the risk of mental health concerns by even up to 50%. And the more rounds of antibiotics, the higher the risk. Now, we know that in adults too. So we just have to know this is what it is. And if my kid had antibiotics or they're going to be put on antibiotics, let's use a microbiome recovery plan. And I outline all of that, but just so you guys know, part of it is the first part is when I call it the gut reset. The RE means returning to the 5 things that create microbiome magic. And these are the 5 things that you and your kids already do every single day. It's not an add-on. We're all busy. I don't want to tell you another thing to do, but it's things that you're already doing. We're already eating and moving and sleeping and hydrating, and we're already breathing and hopefully engaging our vagus nerve. But how do we teach our kids and ourselves to do that like a gut hero so that we can create microbiome magic with those things? So the foundations are key. It's not just about throwing in, a gazillion trillion colonies of probiotics, which that plays a role, but it's kind of, I tell kids, it's not probiotic pills or supplements. It's not like Jack's Magic Beans. You cannot just throw the probiotics in your gut and expect this huge colony of amazing friendly bugs to grow in your gut. without the foundations, without the right soil and the ecosystem. So that's when we return to the 5 things. But we also know that antibiotics can trigger something called leaky gut, which some of your listeners may have heard of, something called gut dysbiosis, where there's an abnormal balance of beneficial and not such beneficial microorganisms in your gut. And so the key with taking antibiotics or afterwards is we want to prevent leaky gut from occurring. And we want to prevent this dysbiosis from occurring. So if you want to prevent leaky gut from occurring, there are certain nutrients that can help. We need a really, really healthy small intestinal lining. So that keeps your immune system healthy and happy. But that might be things like a zinc supplement or zinc rich foods, right? Getting in your animal proteins, getting in your nuts and seeds and your legumes that are really high in zinc, getting in glutamine, which is an essential, it's an amino acid that is really critical for a healthy gut lining, and our omega 3s. So eating fatty fish and taking a fish oil supplement, because that also helps restore a disrupted gut lining. So there are lots of things we can do. But the key is, if you're taking antibiotics right now, if your child is taking antibiotics, even your teenagers who are taking a very low dose of doxycycline for their acne, that still counts. So we want to do these things while you're starting the antibiotics. And then the probiotic supplement, you just take it another time of day. So away from the antibiotics. I've heard lots of myths. I've heard lots of parents say they've gone to the ER and been told by the ER doc, well, don't take probiotics right now because it will inactivate the antibiotics or will make the antibiotics less effective, which is definitely not the case. But it is true that the antibiotics could kill the probiotics. So you just take your antibiotic. Let's say you're taking the doxycycline once a day. You take your probiotic supplement at another time of day.
Got it. And do you personally have a probiotic through your company that you recommend, or what's our best route for the probiotic?
So that the best route is the probiotic. This is going to be kind of a hand waving answer because there's lots of different probiotics out there. We all know that. You can go to the store and you're like, oh my gosh, there's so many, right?
Truly.
But the key is of the thousands and thousands of probiotic strains that have been identified, they each have a different role. Like if your kid has attention and focus issues, behavior concerns, anxiety or depression concerns, we want to give particular strains that are called psychobiotics because they help from a psychological standpoint to improve serotonin and dopamine levels. When we're talking about immune health, we want to give those specific strains. So there are specific strains that have been shown to repopulate the gut microbiome better after antibiotics. And so we have a couple in our online store that have those strains. There's one by Claire Labs that is a really well-known, practitioner grade probiotic. There are other companies that are really, really beneficial, like Designs for Health. But again, it's the specific strains. And in the book, I list the specific strains. So you can go to the store and say, oh, these are the strains that I want. And I'm going to look for those when it comes to my child's antibiotic recovery, or when it comes to my child's brain and mental health or immune health.
Perfect. Okay, I have so many more questions, but tell me where to get the book, because I already know that for one of my children, I need the antibiotic recovery. For the other child, I need, XYZ. So I'm going to have to kind of dive in and see what is going to be best for each one.
Yeah.
Where do I get the book?
Yeah. So the book you can get pretty much anywhere books are sold. If you buy on Amazon or Barnes & Noble, support your local indie bookstores. I'm having parents send me pictures. I mean, it's everywhere now. And if you want more information, you just go to healthykidshappykids.com/book. And there are links to all the different places. So, they say 70% of books are sold on Amazon. I get that, who could live without Amazon? But again, support your local indie bookstores if you have one near you.
I agree. Healthy kids, happy kids. All of us moms want healthier, more resilient kids because frankly, when our kids are healthy, we are also more happy.
Yes.
For me, I speak with so many different colleagues and, how's business going? I'm always like, listen, business is great. We're growing. Things can be better. But I am happy because my kids are healthy. Listen, if my kids aren't healthy and thriving, then nothing else that happens in my world really matters to me.
Yeah, absolutely.
So Dr. Elisa, one of the topics that I've really struggled with as a parent is the topic of vaccines. And I've had a difficult time finding good resources around this topic. I have 5 kids. I had my oldest in Ohio. The maternal care was much different up there. The pediatrician care was much different up there. Oddly enough, in Florida, I had a harder time finding an OBGYN, finding a pediatrician. And then by the time my fourth and fifth rolled around, I'm like, screw it. I'm having these babies at my house because I actually trust myself more than I trust the doctor at the hospital and which it is what it is. And
Yeah.
those
Yeah.
2 home births ended up being 2 of the most powerful moments of my life.
Yes.
And with the 2 home births, I also didn't take them to a pediatrician, because often you have a baby and you do the traditional route, you're in the hospital, and then by the next day, you're
Yeah.
in a pediatrician's office surrounded by kids coughing and hacking, and they got the
Yeah,
flu,
for
and then
sure.
they're, giving your kid 20 different vaccines within the first 2 months. And by the fourth and fifth, I'm like, I'm not feeling good about this. Like, I don't trust what I'm being told by the, pediatricians in Florida in particular. And so was kind of looking for better resources and
Yeah.
ended up finding a wonderful gal who works with us at the house. And I did my own research and kind of presented to her like, hey, here's the strategy that I want to go through. But tell me what you recommend and how you kind of navigate that conversation with parents.
Yeah. Well, so I will tell you, my approach is really, it's an individualized, personalized approach. I mean, that is truly where the future of medicine and the future of pediatrics must lie, because we are not the same cookie cutter individuals, families. We have such unique family backgrounds and histories. We have such unique personal histories, even from one child to the other in your family. They're so uniquely different, and they have their own genetic makeup, which means that they have their own epigenetic potential. And what that means is our genes are not set in stone just because diabetes or heart disease or anxiety or bipolar runs in the family. What I tell kids is, I don't care how many uncles or grandparents or whomever have this. That doesn't mean you are. It means that you might be more at risk. However, we even know from identical twin studies, and I have an identical twin sister, and but from a health standpoint, we're just very different. Same genes, but we know for identical twins, same exact genes, well, only about 50% of the time do they develop the same diseases. What does that mean? That means 50% or more is in our power and our control.
Wow.
And we are starting to uncover and understand what some of these factors are, but they are largely environmental. They're largely, I mean, we can talk about all the environmental toxins, but it's not just that. It's, it's the environment around us. It's even our own thoughts, our own psychological environment. And it's what we put in our bodies, from the foods, the medications, even the vaccinations. And so there is this whole field of vaccine study. They're twofold. There's one area of study called vaccinomics, which is trying to take this individualized approach to see from a genetic standpoint, which genes and how do we make these vaccines more effective, right? That's one area of study. Now, there's another area of study called adversomics, which tries to identify the genetic SNPs, they're called, these little tiny variants. It's not huge genes, but little tiny variants. Which of these variants put someone more at risk for an adverse reaction? If we could marry the two, I mean, then we would have a completely individualized, personalized approach so that we know, I mean, we have identified, I mean, and I've done a lot of research on this and I teach practitioners about this. But we do know, for instance, there are certain genetic variants that we can predict that this child with those variants is more at risk for having seizures from the MMR varicella vaccine combined. We also know from, a vaccine efficacy standpoint that exercise the day before and the day of makes the vaccines more effective, or sleep, or eating fruits and vegetables. I mean, but not a lot of people are talking about it, because from a public health perspective, it has to be a one size fits all approach, right? But when you have your little child in front of you or your little baby in front of you, and I have this little patient in front of me, it's all about this particular child. So I wish I could say there's one approach that I recommend for everybody. There's not. But I take into account family history of autoimmunity, family history of mental health concerns, family history of prior adverse reactions to vaccines. And I help parents try to navigate that. Now, for some of my families, there's not much of a quote choice, because both parents are working. They need to put kids in daycare early on or otherwise they can't. Right.
Yeah.
So they're kind of stuck in that way. But I'm going to say as a general rule of thumb, what I typically recommend, at least at first, is just one at a time.
Yeah.
Right. I mean because otherwise, if you get, the 5-dose combination at one time and your child does have an adverse reaction, you don't know which one it was to. You can't isolate that. Right.
Yeah. Yeah.
I also strongly recommend, I've had, when I was on, Dr. Hyman's podcast, Mark Hyman's, he asked, well, you must see, all of these reactions. And I said, well, I don't in my practice, because I also prepare kids before and after with, making sure that their immune system is really in the most prepared state. And I have a whole, vaccine support supplement plan before and after. And this is for adults, teenagers, for any age, because we know that when we can support your mitochondria, when we can support your detoxification, liver enzyme capacities, when we can support your immune regulation, then you have the best chance possible to mitigate any of the adverse reactions that we don't want. And so, I mean, that really is my approach. And, if you're a nurse, once you've had your baby, those antibodies from you that were passed through the placenta, they last a good, 6 months at least, maybe 9 months. If you're breastfeeding, all of those immune factors and antibodies, those are going to continue to last, which is often why the baby typically is, gets the least of the things. And then, mom
Right.
gets everything. Right. Especially if you have older kids, but you're
Right.
making all those good antibodies that then get through to your baby. And so, regardless, and we also know, obviously through the pandemic, we've come to realize, okay, there's no vaccine that's 100% effective at preventing you from getting anything. So bottom line, no matter what you choose for your family, and I really do believe it should be a choice for families, you still have to build up that immune resilience.
Yeah, I think that was an excellent answer. And I wish there was a one size fits all solution. There is not. It can
Yeah.
be extremely overwhelming for us moms to try to find the right solution for our kiddos. But the nugget that you shared, which I think is so key, is in your recommendation, go one at a time. Where when I was in Ohio, the recommendation by a pediatrician was get these 4 or 5 by the 2-month appointment or at the 2-month appointment, because they knew that many parents would not come in for the 4-month appointment or the 6-month appointment. And it wasn't because they thought it was best to do 6 shots all at once. They just simply were looking at data and saying, most people come in for the 2-week and the 2-month, and then we lose them. So let's go ahead and just load them up, where I have the opportunity to say,
Yeah.
okay, we're going to slow this down. We're going to do one at a time. Even the MMR for my youngest, man, it left a welt for 3 solid weeks.
Yeah.
3 solid. And I'm like feeling guilty, for 3 solid weeks. My 3-year-old was required to have a particular shot. It might have been the MMR or the DPAP. I forget the names of them, but to be at her school in Costa Rica. In fact, they came to the school, and any kid who didn't have the
Wow.
record, they
Okay.
literally at the school gave them the
Yeah.
shot. If it wasn't on record, I'm like, no, she just got it. Like, she doesn't need another one, type thing. So that's in a different country, but it's overwhelming. It's confusing. It's scary. I like your recommendation first and
Well,
foremost, the value that you have that every family should be able to decide and
yeah.
choose. And then one at a time, I think is good.
Well, and I think to your point, a lot of times you go to the doctor's office and, not all doctors are like this, but we've all had, I've even had experiences going for, when my mom was ill and going to doctor's appointments with her, even for me as a doctor, sitting there feeling like, oh my gosh, I'm just getting bowled over by this information and feeling pressure to make this decision now. But I want more information. And so just know as a mom, a dad, who caretaker, you have every right to question the treatment plan. And it's not to say you're saying no or, being really argumentative. It's just like, this is a decision I'm making for my child or for myself or for a family member. And so it's a different time than a lot of us growing up, the doctor in the white coat, like they were the authority and you just
Right.
did whatever they were told, no questions asked. And so it's a different time. And when we start asking the questions of our doctors and our kids sit there and listen and know, oh, I can ask the questions. Hey, doc, what is this for? What are the side effects? Is it really necessary? In fact, I list 6 questions in the book that you should ask every doctor before you start antibiotics, right? Because we
Great.
just want to feel empowered. But our kids learn that too. Then our
Mm,
kids learn to be their own best advocates. And we want them to do that because when they're in high school going to their own doctor's appointments or in college, navigating the healthcare system as young adults, they have to have the confidence to say, can we stop for a moment here and just discuss, what is this medication? Is it really necessary? What are the side effects? What are my options? And that, like, when I have a kid who goes off to college and can start having that conversation with me, I know, all right, I've my job is not completely done, but it is almost done because now they can advocate for themselves.
that is fantastic. Dr. Elisa, I truly appreciate your time. I can't wait to dive into your book because I want to learn more about the mental wellness side as well, specifically for the tweens and the teens, because I think there's so many things we can and should be doing as parents to really support our kiddos on that front as well. So tell us again where to find you online. And then we're
Yep.
going to go to happykids.com as well.
It's healthykidshappykids.com. So that's my website. On Instagram, it's healthykids_happykids. And I love that you said about the, really for your tween and teens, because this book has tips. They're based on exactly what I tell patients from like little toddlers all the way up to teenagers. It's a message that resonates no matter how old you are. And it's something for the whole family. And so again, it just makes things fun. It helps kids understand the why so that they understand, oh, now I'm going to do the how of it. So, but again, healthykidshappykids.com is the best place to find me.
Fantastic. Thank you so much for your time. We truly appreciate it. And we can't wait to follow you online. Bye, everyone.